The universe is full of mysteries. We look to the stars and wonder about life on other planets. But some of the darkest mysteries are here on Earth. The Tuskegee syphilis study is one of them. It is a story of betrayal and medical abuse. It is a story that still resonates today. This study, conducted in Macon County, Alabama, targeted African American men. It lasted for 40 years, from 1932 to 1972. Researchers from the U.S. Public Health Service wanted to study the natural progression of untreated syphilis. However, they did so in the most unethical ways imaginable. The Tuskegee Experiment is a stark reminder of the harm that can be done in the name of science. It is a story we must remember to prevent it from ever happening again. The pursuit of knowledge should never come at the cost of human dignity and life. Please like, share, comment, and subscribe to help spread awareness and ensure history does not repeat itself. The Tuskegee syphilis study began with good intentions, but those intentions quickly became twisted. Syphilis was a major health problem in the early 20th century, especially in the South. The disease disproportionately affected African Americans due to poverty and limited access to health care. Researchers saw an opportunity to study the disease in a population where it was prevalent. Their initial goal was to observe the natural progression of syphilis in Black men. They believed this knowledge could then be used to justify treatment programs. However, the study was flawed from the beginning. Researchers failed to obtain informed consent from the participants. The men were not told they were part of a study, nor were they informed of their syphilis diagnosis. Instead, they were told they were being treated for bad blood, a catch-all term for various ailments. The Tuskegee study unfolded over 4 long decades, during which time the researchers continued to deceive the participants. The men were promised free medical care, meals, and burial insurance for their participation. However, this treatment was a sham. The researchers never had any intention of providing real treatment for the men's syphilis. Even when penicillin became the standard treatment for syphilis in the 1940s, the men were denied access to this life-saving drug. The study continued year after year, with researchers observing the devastating effects of untreated syphilis on the men's bodies. Many of the men experienced severe health complications, including blindness, heart disease, mental illness, and death. At the heart of the Tuskegee Experiment's horror lies the egregious violation of informed consent. Informed consent is the bedrock of ethical research. It means that participants must be fully informed about the risks and benefits of a study before they agree to participate. The men in the Tuskegee study were never given this choice. They were misled about their diagnosis, the purpose of the study, and the risks involved. They were never told that they were being denied treatment that could save their lives. This lack of informed consent was a fundamental breach of trust. The researchers exploited the men's vulnerability, taking advantage of their poverty and lack of education. They treated the men not as human beings, but as mere subjects in a cruel experiment. Section 5. The human cost lives torn apart by syphilis. The Tuskegee Experiment had a devastating impact on the lives of the men and their families. Many of the men suffered from the debilitating effects of syphilis for years, enduring pain, disability, and social stigma. Some men died from the disease itself, while others experienced complications that shortened their lives. The experiment also had a profound impact on the men's wives and children. Syphilis can be transmitted from mother to child during pregnancy, leading to congenital syphilis in babies. Many children of the men in the study were born with this condition, which can cause serious health problems, including developmental delays, blindness, and death. The Tuskegee Experiment left a legacy of pain, mistrust, and anger in the African American community. It shattered the bond between doctors and patients, creating a climate of fear and suspicion that persists to this day. Section 6. Public outrage. The experiment exposed. The Tuskegee syphilis study remained hidden from public view for decades. However, in 1972, a whistleblower named Peter Buxton, a former venereal disease investigator, learned about the study and was horrified by what he discovered. Buxton contacted the media, and the story quickly gained national attention. The public was outraged by the revelations of the study's unethical practices. People were shocked and angered that the government could allow such a morally reprehensible experiment to continue for so long. The expose of the Tuskegee Experiment sparked a public outcry. People demanded justice for the victims and accountability from the government. The study was quickly shut down, and a class action lawsuit was filed on behalf of the participants and their families. Section 7, a turning point. The aftermath and new protections. The Tuskegee syphilis study stands as a dark chapter in American history, a stark reminder of the potential for abuse in the name of science. The public outrage over the study led to significant changes in the way medical research is conducted in the United States. In 1974, Congress passed the National Research Act, which created the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. This commission was tasked with developing ethical guidelines for research involving human participants. One of the most important outcomes of the commission's work was the Belmont Report, published in 1979. The Belmont Report outlines 3 fundamental ethical principles for research involving human subjects: respect for persons, beneficence, and justice. These principles have become the cornerstone of ethical research conduct in the United States and beyond. Section 8. Remembering Tuskegee, Lessons for the Future. The Tuskegee syphilis study is a story that continues to haunt us today. It is a story of racism, medical abuse, and the exploitation of a vulnerable population, but it is also a story that holds important lessons for the future. The Tuskegee Experiment teaches us that ethical research is not just about following rules and regulations. It is about respecting the dignity and autonomy of all human beings. It is about ensuring that research is conducted in a way that benefits society as a whole, without harming individuals or communities. We must never forget the victims of the Tuskegee Experiment and the suffering they endured. Their story must serve as a constant reminder of the importance of ethical research and the need to remain vigilant against any form of exploitation or abuse in the name of science. Section 9. The Legacy of Tuskegee, a Call for Vigilance. The Tuskegee syphilis study casts a long shadow over the relationship between the medical community and communities of color. The study's legacy continues to fuel distrust and suspicion, making it challenging to recruit and retain minority participants in clinical trials and other research studies. This lack of diversity in research has serious consequences. It means that medical treatments and interventions may not be as effective for all populations. It also means that we may miss out on important scientific discoveries. We must actively work to rebuild trust and ensure that all communities have equal access to the benefits of medical research. This requires acknowledging past wrongs, engaging in open and honest dialogue, and working collaboratively to create a more just and equitable healthcare system for all.